Hi, everybody. Welcome back to the Christian Capitalist Podcast. I'm so glad to be joined today by Trey Abshier, the CEO of Ascension Sacred Heart, Emerald Coast Hospital. We're here in his office today in August and going to enjoy a terrific conversation about serving the poor and needy in the name of Jesus. First, though, I want to give you our usual kind of housekeeping message that we love for you to follow along. Share, like, and follow this podcast episode wherever you see it. Please feel free to leave comments. We love hearing from you about our topics. And as always, you can find out more about our mission and movement at christiancapitalist.life, including a link to Amazon to buy the book. So, good morning, Trey.
Good morning.
It's good to see you.
Absolutely.
Y'all, before we got online, Trey was just saying, so have you been to the hospital before? And I said, no. And sometimes that's a good thing.
That's always, well, most times it's 90% of the time it's a good thing.
90% of the time it's a good thing.
Unless you're delivering that baby, it's probably not a place you want to hang out.
Exactly. And so that's a great way for us to get started. So Rebecca and I are blessed to have three kids who are now 25, 23, and 20. Our 25-year-old, James, was born at St. Vincent's in Birmingham, all right, 25 years ago in March of the year 2000. So Rebecca had an appointment today here for the first time since we moved here 3 years ago. She was in the system and she was shocked. I couldn't believe it either. I was like, how on earth did you get in the system? She said, they have our Birmingham address from 25 years ago. Isn't that something?
That's impressive. I'm shocked.
I am too. But that's a great place for us to get started.
Yeah.
How has healthcare changed during your career, and kind of what changes have you seen that led you to sitting here in August of 25 talking to me?
Yeah. And first of all, thanks for having me a part of this. I am now entering my 20th year in this career, in this business, in this calling, if you will. It is what I know. It's all I know. I tell people often, if this doesn't work out, I am not sure what I'm going to fall back on, because this is all you get.
Right.
But it's constantly changing. If you're not adaptable in this line of work, it might not be for you. Things change monthly, daily, weekly sometimes. I think there's so many changes. The one that comes to mind is just that migration to outpatient services. 20 years ago, 90% of our work, our care was delivered on an inpatient unit. Length of stay was 2, 3, 4 days. And over time, so little of our work is done on an inpatient unit, so much as go home same day. I would say 90%.
Wow.
At Emerald Coast specifically, of our patients go home same day. And I would say a lot of our surgical work is no longer done in a hospital setting. It's done in an ambulatory surgery center. And that wasn't the case 20 years ago.
Sure.
So it's changing with those times. How do you navigate? How do you build relationships with those physicians that no longer need you as much as they once did to take care of their patients? So that's probably the one change that I call out when I think about all the other changes that have happened.
Not to mention, we are recording this on a laptop computer using the internet Wi-Fi signal that's here in the hospital. The fact that medical records from our son's birth 25 years ago were electronic in any way back then is also a surprise to me.
Yeah.
But how about the technology of healthcare? I mean, everybody's talking about artificial intelligence these days. What have you seen technologically that has kind of changed the way the hospital works?
Yeah, again, going back 20 years, paper charting, staff spending a lot of time, physicians spending a lot of time sitting at a paper chart, documenting. And not that documentation has not changed, it's just no longer on paper.
Yeah.
And so it's very common to see a caregiver walking around with a tablet or a laptop, a work on wheels system, as we call it here, and our physicians doing the same. So that work is supposed to make life easier and more efficient for our providers, but certainly you will not find much paper on our nursing units any longer like you did 2 decades ago.
Right.
Yeah.
So what got you 2 decades ago? What got you into hospital administration?
Yeah. So quite the boring story, unfortunately, for your guest. But I had a best friend's mom who was in the hospital administration business. And as a high school kid, when you're starting to think about, all right, college is coming up. What do I want to be when I grow up? I don't want to get into a situation where post-graduation, 5-10 years, I'm still trying to figure out what I want to be when I grow up. And she had an enjoyable career. She would share with me the good and the bad of her career and thought it was something that I should take a look at.
Mm.
Ended up working out for me 20 years later, and hopefully another 20 years to go. But yeah, it kind of started there. I got lucky, ended up choosing to pursue a degree in human resource management as an undergrad, and then further that education in graduate school at Trinity University with a master's in healthcare.
Right, at Trinity in San Antonio.
Yes.
And for those who can't see the Kleenex box
Yes.
on your desk, where did you go get your undergrad degree?
Yeah, so if it's not clear to those viewing, I grew up in Louisiana, in Baton Rouge, and pursued an undergrad degree at LSU. So I am a LSU Tiger and then a Trinity Tiger from a graduate
and then a
school.
Trinity Tiger, right?
Yes.
That's great.
Yeah.
So when you started off in hospitals, once you got your MHA, what was your first hospital experience like? Have you always been in Catholic hospitals?
So I'll answer that second question first. No. Working for Ascension now, I'm a year into my time with Ascension, is the first time I have ever worked for a faith-based, not-for-profit healthcare system. My entire career has been on the for-profit side of healthcare with two different organizations. So I started my career in the for-profit sector right out of graduate school as what's called an administrative resident. So the first year of that work is spent learning the ropes of healthcare, working in departments, spending time administratively, really with the assumption that I know very little, which is true, about how healthcare works. And this is your time to learn as much as you possibly can to prepare you for a future in that business.
So for-profit work for what, 17, 18 years?
Yeah.
To then move over to Ascension, which, as you mentioned, is nonprofit and Catholic. What motivated you into that transition? Just this week, for those of the audience, including myself, many of our listeners and viewers are in liturgical churches that have lectionary readings, and there's the Revised Common Lectionary. This past Sunday was the story of Abraham and Sarah, only at that time he was Abram. God comes to him and says, look, you're old and Sarah is barren, but look at the stars and your descendants will eventually outnumber them. And Abraham follows God. Did you have that kind of experience?
I wish I could tell you the answer is yes, but no, mine was probably a little bit different. So again, spent my first 18, 19 years for-profit healthcare, worked in a few different states over that time, but I built relationships with individuals during my career and during some of those times who transitioned from the for-profit sector to Ascension. And lucky for me, I had developed such good relationships with those individuals, and they were having such a great experience with Ascension. Were actively talking to me over the years about different opportunities within the Ascension network. And the timing just was never right in terms of the opportunities or where I was at from a personal and professional experience. And this opportunity at Ascension Sacred Heart Emerald Coast ended up being the right time for me professionally and personally. And so I was able to make that transition just over a year ago in July.
Okay.
And it has been a blessing. It has been refreshing to join an organization that really puts that patient first and foremost. The business is the business, whether you're on the for-profit side or the not-for-profit side, but the way we at Ascension treat our patients and associates is very different from what I've experienced in previous lives.
How so?
It is truly a calling to treat the poor and vulnerable at Ascension. Regardless of your ability to pay, we will treat you like we treat everyone else when you walk through our doors. And that is not always the case anywhere you go throughout the country. But I can tell you with Ascension, it's first and foremost, it's core to who we are. And I'm happy to be able to lead an organization that truly believes in that mission.
So I have a copy of the book here. Most of the folks who are watching this have seen this before. The Christian Capitalist is about hard work and generous giving. That's all we could fit on the title. The rest is to the poor and needy in the name of Jesus. So one of the reasons I'm so excited to get to talk to you today is what you just described, that dynamic. There's a lot to discuss there. And I suppose the first is starting with the name of the hospital itself. For those who are not here on Emerald Coast, we have a national audience, international.
Internet, right?
Yeah, it turns out we're big in France for some reason.
Fantastic.
I was just looking at the reports through the end of
Let's take
July.
a road show.
Exactly. So for those of the members of our audience who aren't familiar with the system, can you kind of break down the name? Ascension Sacred Heart Emerald Coast is a lot to kind of unpack. So can you go through that with us?
Sure. And I'm probably not the best Ascension historian that you'll find, given my relatively short tenure within Ascension, but it dates back many, many decades over time. And so there were many organizations, not-for-profit, faith-based organizations that came together many, many years ago to form Ascension.
So Ascension is a national system of hospitals.
Yeah, Ascension is a second largest not-for-profit, faith-based organization in the country.
Okay.
Currently own and operate 96 hospitals across the country, plus ambulatory surgery centers, physician clinics, imaging centers, various clinical care sites throughout the country. So we're located in very specific states and continuing to grow as we progress over time. Specifically to the Sacred Heart is really centered around our market here in the Panhandle. So Ascension, Florida makes up 9 hospitals.
Okay.
It's an interesting market for Ascension due to geography.
Yeah.
We have really many markets, the Panhandle being one of them, and we go by the brand Sacred Heart. So there are 5 hospitals that make up the Sacred Heart brand for Ascension in the Panhandle. We're one of them, of course. Yeah. And then go to the east coast of Florida in Jacksonville. The brand is St. Vincent's,
interesting.
which was also the brand in Birmingham at the time.
Yeah.
And so really Ascension, Florida makes up 2 different markets. We have the St. Vincent's brand in the Jacksonville side, which is 4 hospitals. And then on our side, the Panhandle side, we're the Sacred Heart brand, which is a very nationally recognized brand on the Panhandle side. So that's the 2 distinct differences between our markets.
Gotcha.
Not to mention 6 hours in a time zone zone.
Exactly. Yeah. So, and then Emerald Coast reflects the community that we are in of the 5.
Right. So I represent Ascension Sacred Heart Emerald Coast. So I have the pleasure of leading this team here. This hospital has been around since January of 2003.
Oh, so pretty new by comparison.
So Ascension bought, Ascension owned from day one.
Gotcha.
And so we've been around, 20 plus years, relatively short time when you look at other hospitals in the area. But yeah, we've been Ascension Sacred Heart from the get-go. We've certainly evolved over time.
Yeah.
And we serve a core mission, and there was certainly a community need for this facility 22 years ago, and there still is one today.
Absolutely. So I have to tell our audience, my wife Rebecca and I and our dog Cowboy live about 5 minutes away. So this is our community hospital, and we're so glad you're here and doing such a great job and taking care of our community here in Destin and the surrounding area. I have to say, on a regular basis, we hear jets fly over. We know those are typically Air Force fighters over at Eglin Air Force Base. But on a much less regular basis, but still enough that it's common, we hear helicopters. And whenever we do, we say a prayer. Tell us a little bit about the helicopter, where it's taken people and how that works.
Yeah, so that could be us transporting patients when the weather is friendly to us.
I'm assuming it's not you going back and forth to your house.
No, I'm not traveling the country. No, definitely not me. Yeah, so if you're hearing a helicopter transport patients out, that's primarily probably us sending to a higher level of care. So a little bit about Ascension Sacred Heart Emerald Coast. We are an 86-bed hospital. 10 of those beds are level 2 NICU beds. And we are mostly an outpatient facility, as I mentioned before. So busy orthopedic program, busy general surgery. We delivered over 1,400 babies last year. So although we are treating the retirement community that lives here, we're also treating a younger population.
Yeah, that's a lot of babies.
That's bringing in a lot of babies into this world. And so we do not take that lightly, but we're not able to provide all services to all patients due to our limited size. Luckily for us, we have 2 sister hospitals on either side of us, Ascension Sacred Heart Pensacola and Studer Family Children. And then we also have a hospital in Panama City, Sacred Heart Bay. And they are our care partners. So if there is a patient that we're not equipped to care for clinically and safely, we will utilize our sister hospitals for higher levels of care. So when you hear a helicopter, they may be transporting a patient, a NICU baby perhaps, that needs some sort of care that we can't deliver here to one of our sister hospitals for
Gotcha.
care. Yep.
Gotcha. So Trey, as you and I have discussed before, I'm a retired healthcare lawyer and have represented dozens of hospitals over the years. For many of America's hospitals, delivering babies has turned out to be too expensive, too challenging, don't have the right staff. To hear that Sacred Heart Emerald Coast is delivering 1,400 babies a year is such a blessing. How does that change the dynamic of this hospital that you mentioned is primarily outpatient these days?
Yeah.
Right? And it almost sounds like you're focused on babies.
Yeah. I would certainly tell you, and I've told many this, it is certainly our signature service line currently. It is what we are known for the most. When you're bringing that many lives into this world, it obviously is for you. And it's a smaller community, as you know, Rich. And so that's the service that people know us for the most. But when you think about it, typically women are the healthcare decision makers. And the idea really is centered around not only bringing those lives into the world, but if you're having a great experience with us, you're likely to come back to us for the rest of your care going forward. And that's what we typically see here. The experience that people get in our family birthplaces is really second to none. And we're looking to grow that with the growing population that needs us.
So for our audience who's not familiar with healthcare like you and me, what is a NICU? And the fact that 10 out of 86, so more than 10%, can't do that math real fast, but more than 10% of your beds are NICU. What does that mean for those babies?
Yeah, so there's different levels of NICU, 1 through 4, 4 being the NICU departments that can treat the sickest babies around. We are level 2, and we have visions of growing that to be able to care for more babies in the future. But as it stands today, and we've been a level 2 NICU for 5 years. We just celebrated the NICU reunion earlier this year, which was fantastic to see those families and babies come back that aren't babies any longer, to celebrate all the great care that was delivered here. But it really allows us to treat those babies that otherwise would be transferred out of this market to receive care elsewhere. And so there's very specific criteria for the type of babies that we can treat as a level 2 NICU. But we have an incredible physician and provider team that is in-house 24/7 to treat those particular babies. Staff here 24/7. And I just want to share, we just added what's called an OB hospitalist program. Because of that service line and the way it has grown, we felt the need to add in-house OB physicians 24/7.
Wow. So these physicians just focus on obstetrics, just delivering babies.
They are here exclusively to take care of our moms and babies in time of need.
Isn't that wonderful?
In-house 24/7. And so that is, we're 30 days in to that new program.
Congratulations. That's
so we're
great.
Excited about it. We think it's a game changer for Emerald Coast and the family birthplace. And so we're spending a lot of time, a lot of resources to continue to improve that service line for many years to come.
I love it. So when we talk a little bit about I'm making a note here, new hospitalist OB program. When we talk about 1,400 babies a year being delivered here and in this community, you mentioned the perception, I have a feeling, for most folks in the Emerald Coast and the Panhandle. And frankly, for our viewers in the Midwest who know a little bit about our beautiful Emerald Coast here, right? They think of this as a vacation destination or where people retire. So when we talk about these babies being born, presumably they're not like Abraham and Sarah. They're not being delivered by moms in their 70s or 80s.
No, right? We don't see a lot of that.
But this is an opportunity to talk about the poor and the needy, right? One of the things you and I were discussing beforehand is the number one value here at the hospital is serving the poor and needy with a spirit of generosity. And I just love that. That's what our whole mission is about. Do you find that, what kind of percentage of those 1,400 babies are from folks in our community who are poor or in need?
Yeah, I don't know that I could tell you a percentage off the top of my head. But at times, and if you're not familiar with this area, or if you're familiar with this area, many will think, including me, when you look at the area, you think retirees, you think wealth.
Right.
It's beautiful here,
Right.
but you and I both know that there's other parts to Walton County and Okaloosa County, and there are those in need. There are those struggling. There are those trying to make ends meet. But we're here for that patient too. So regardless of who you are, what your situation is, again, going back to how we opened, we're going to treat you like we would treat the wealthy or successful. It does not matter to what we do. We thrive in that space, and again, it's who we are and what we believe in, and that's not going to change.
Isn't that wonderful? And I have to say, we have had as a guest on our podcast before my friend Valerie Barkoff, who was revenue cycle vice president at St. Joseph's in Atlanta. So we got into a very detailed conversation about cash flow and bad debt and how you just treat the poor differently. From your perspective as the CEO, I love the fact that you just, no matter what you have, you're going to be treated the same here. So talk to us a little bit about how people respond to that. When you have folks come here and they may not have any insurance at all, or they have insurance that makes them have a high deductible. What is that experience like for them, and how do you perceive that 1 year into the job?
Yeah, I think what many would probably tell you is that they have some comfort knowing that we are going to work with whoever you are, whether that is payment plan set up, whether that is some sort of charity discount, that we have all sorts of ways that we can help make ends meet so you still get the care that you need and expect to receive when you come to this particular facility. And so I take great honor in knowing that we will be creative and try to work out a way that we can still treat that patient and they can get the care that they need, and we can still give them the resources that they require.
So earlier you mentioned the business is the business. For those who are watching our podcast today and saying, okay, well, if you're committed, this is kind of the way it goes at churches too. Why do we even pass the offering plate? Right? If you're
two offering plates at times.
Exactly. If you're committed to serving the poor, why charge anybody at all?
Okay. Yeah.
So let's talk about the business is the business.
Yeah. Well, again, we are a building, a large campus that really has 600 plus associates.
Wow.
We have 300 plus medical staff members here.
So associates are folks who work here full-time?
Employees, yeah, we call them associates.
And medical staff members are physicians?
Full-time, part-time, yeah.
Wow.
And most of our physicians, 80% of them are independent physicians. So we do have a handful, a small percentage that are employed by Ascension in some form or fashion that have busy private or practices in the area. But similar to a non-healthcare business, we want to pay our staff to be able to treat the patients. We want to have the latest and greatest technology for our patients and our staff and our medical staff. And so, as most know, healthcare is not an inexpensive business to be in. Equipment costs significant dollars, sometimes outrageous, but that's the way healthcare is moving, right? Robotic technology, quicker recovery time, less scarring, less bleeding, get you home sooner, all that great stuff. So,
not to mention 10 babies in neonatal intensive care, right?
All that to be said, it's still a business at the end of the day, from when you think about it from that perspective. And so we still treat those that are in need, and we always will, but we still need to make sure that we have a fiduciary responsibility to the greater Ascension to pay our staff, to keep equipment up and running, and make sure that our building is second to none when it comes to caring for our population.
So you mentioned that the bulk of your career has been spent in for-profit situations. For those in our audience who don't know the difference between a for-profit and a nonprofit, what does that mean at a kind of a fundamental level from your perspective?
Yeah, I think those lines get blurred sometimes over the years. I think the best way to look at it from a for-profit perspective, you have investors, you have stockholders. Those individuals expect a return on their dollars in terms of what that particular company is earning. And when you come from a not-for-profit perspective, that doesn't exist, right? The money that we earn here is getting all reinvested.
So nobody owns this hospital, right?
Back into the hospital. And so I love that aspect of it, to know if I'm doing a good job here from a finance perspective, that money's coming back to me and I can reinvest it into technology, equipment, infrastructure, adding beds to our family birthplace to support the boom around birth in the market, because we want to be able to accommodate the growth that's happening here.
I love that. God's calling me to read the theme of the book to you.
Okay.
Because I want to tell you a quick story as I was walking in from the parking lot, but just to set the table, and those in our audience certainly have read the book, know this. So this is from Paul's letter to Timothy, his first letter, and the theme of the book. As for those who in the present age are rich, command them not to be haughty or to set their hopes on the uncertainty of riches, but rather on God, who richly provides us with everything for our enjoyment. They are to do good, to be rich in good works, generous and ready to share, thus storing up for themselves the treasure of a good foundation for the future, so that they may take hold of the life that really is life. That's the return on investment, right?
Yeah.
So as I walked in from the parking lot to meet you in your office today, I walked past a coffee truck called Kingdom Coffee.
Okay.
So let's talk a little bit about faith in the workplace. Yeah. For whoever owns Kingdom Coffee, I love that. They got a cross on the side of the truck. The name indicates that they're followers of Jesus and working towards the kingdom. And many of the folks in our audience and who have read this book are for-profit business owners or work in for-profit businesses that struggle with how to talk about Jesus at work. Because one of our core concepts is we glorify God through our work. Seems much easier here. Your assistant Nancy this morning told me, "Oh, we just finished morning prayer."
Yeah.
So tell us about
every
that.
morning.
Tell us about what it's like to work in a hospital where you're able to talk about Jesus on a regular basis.
So that's a great. I'm glad you came to that, because that's also, I would say, a difference that you wouldn't think of going from a for-profit to a not-for-profit faith-based organization. Is you're able to have prayer, and I think that was new to me, someone coming from the for-profit environment. Yeah, every morning we start our day 8 a.m. with a prayer from our chaplain. So you'll hear that.
Ooh, over the intercom.
Overhead.
I didn't realize that.
Yep.
I thought it was just the folks here in administration. Man, that's great.
But we always need some extra. We always take extra. We take extra prayer, and we have pet therapy dogs, and I require them to come give us some pet therapy every Friday.
Awesome.
So don't forget about admin. We need some therapy too. And so we love having those pets, those dogs here on Fridays. But yeah, every morning 8 a.m. Our chaplain will share a prayer with the entire hospital. So that intercom is throughout the entire
So
campus.
Associates, patients, guests, and visitors, everybody.
Correct.
Fantastic.
Yep, everyone. And depending on who you are, you can choose to stop, choose to not stop. It's there for you if you want to take that prayer. But also, in terms of sort of my daily schedule, we typically start all of our meetings with prayer, either a reflection or a prayer, depending on what you're comfortable doing. And so that might be during the course of a 10-hour day, I might hear a prayer, share a prayer 4 to 5 times a day.
Isn't that something?
And wasn't really sure how I was going to respond to that, being new to a for-profit faith-based system. But what I'll tell you is, it is refreshing. It is nice to take a pause, a moment, and just think about the day, reflect on the previous day. And so I really enjoyed that aspect of faith-based healthcare. Also, what I'll tell you, probably walked past that, I'm not sure if you noticed, but we also have a chapel in the front of the hospital. So we have Mass every Thursday morning, which is open to the public as well.
Oh, that's great.
But it's also used by our families mostly, and associates, if they ever have a need to tap into that chapel. It's available to them too, 24/7.
Isn't that something? So for you as a leader, I feel for you, man, because as we talked about, I've been in hospitals my whole career as a lawyer. For you as a leader, the CEO typically goes one meeting to the next,
Yep.
all day, every day. How does it change the nature of those meetings to start them off with prayer?
Yeah, so same schedule, one meeting to the next. Sad to say.
Roller skates.
Sad, yeah. Sad to say, I'm a subject matter expert in meetings.
Right.
But yeah, instead of rolling right into the next and jumping into the topic, take a pause. Someone will share a reflection 9 times out of 10.
Mm-hmm.
And sometimes it resonates with you more than others, depending on what that reflection or prayer might be. But it's just a good level set, a reminder of who we are and what we're there for.
Mm-hmm.
Because the trap you can fall into, because it is a business, is losing your why. At the end of the day, we're not here unless we're treating patients. And so sometimes it's good for me to take a step back, which otherwise can be a meeting after meeting after meeting that day.
You lose the why.
Mm-hmm.
And y'all are not able to see this in the audience at home. We set up here so we could remind everybody of the name of the hospital, but on one wall is this logo, which is the Trinity, Father, Son, and Holy Spirit with an A in the middle for Ascension. And on the back wall behind us is the cross. Anything special? Well, there's a ton special about the name Sacred Heart theologically. Mm-hmm. Do y'all talk about Sacred Heart specifically at the hospital and what that means? The Sacred Heart of Jesus?
No, we have not. No, not in my short time here.
Gotcha.
Yeah.
Because many of our folks are other denominations. It's obviously a very important reference in Catholics. Their Catholic Church, there's a lot of churches and hospitals out there. Like mm-hmm. you mentioned, people recognize that name.
Yeah, it's nationally recognized.
So having said that, we're talking about the chapel. Issues of life and death are daily here. What kind of experience have you had in your first year with folks coming to the hospital, whether it's with someone who has passed away eventually, and God's called them into the kingdom, or someone who's born here in one of these 1,400 situations and blessings in the last year? Yeah. What kind of religious issues do you see, and how does that kind of affect the way the hospital operates?
Yeah, perhaps I've been lucky in my first year that I cannot recall a time where we've had a robust discussion about some sort of religious issue that has occurred. I'm sure that will come over time. But something I had to learn and still learning with Ascension and Catholic faith-based healthcare come ERDs, the ethical religious directives.
Ethical religious directives.
That help kind of guide us to ensure we're delivering the right care as a Catholic faith-based organization. And so we have those principles, and not that we're referring to those principles on a routine basis. They're a good guideline. And what I find to be great about the Ascension team is that we're well supported from a ministry perspective. So I mentioned Ascension Florida is the ministry that I'm a part of, the 9 hospitals, but we have a chief mission integration officer that sits at a ministry level, and she is there to support me and my team if we do have a situation arise that we're struggling with, that ties to some sort of religious need or expectation. She's there to support us and help navigate. She visits us routinely. So I feel I am certainly not the expert in that space, but I have great support if I have a question.
I love that. And by the way, I just wrote on my notes, mission integration, because your mission, we mentioned the value of serving the poor is listed first. The mission also includes a reference to serving the poor. And I, in the book, use poor and needy. Here in the mission statement is poor and vulnerable, but it's the same. How do y'all, the 600 associates, starting with you as the leader, do you view this as a ministry?
Yes, absolutely, 100%. Yep.
Isn't that wonderful?
Yeah. And I think most of the associates would say the same. We use it. We're in the middle of all associate town hall meetings right now. So that is something that I conduct and facilitate every quarter. Okay. And in those presentations, we'll talk about our ministry, how our ministry compares to other ministries within Ascension, benchmarking best practices. And so, yeah, ministry is used throughout our time here. Very common word.
Gotcha. And, I can't help but think another guest on our podcast was Vanessa Russell, who's the CEO of Catholic Charities of Atlanta. There's a Catholic Charities of Northwest Florida as well. As you know, do y'all work with, at the hospital, do you work with that ministry to help?
Yeah.
What's that? It's this new phrase. When I used to teach at Emory, the students were getting their master's in public health, and there were different kind of certificates you could get. Social determinants of health,
Oh, yeah.
I think is
Yeah.
right. So what does that look like when y'all are trying to take care of people after they leave the hospital?
Yeah. So a couple of different things. First thing I'll say, I'll go back to the resources that I have at a ministry leadership level. A large part of their job is maintaining relationships with all those entities outside the walls of the hospital. So Northwest, that organization, our bishops that are located in this market. So their primary responsibility is ensuring that we're maintaining good relationships and we're meeting the needs of those different organizations and entities.
Gotcha.
Which keeps me out of doing it, and they'd rather me spend my time within the four walls of this hospital anyway, right?
Right.
Which is great.
Right.
But we have a program called My Gulf Care. It actually started in our hospital in Port St. Joe, but we have a group of 4 registered nurses, and they make up this program that is solely focused on getting post-discharge patients into the right care space. So if they're struggling with physician appointments, if they're struggling with getting their medications refilled, if they're struggling with dialysis, those 4 RNs, very special ladies, run a program called My Gulf
Isn't that
Care
wonderful?
that are focused on those individuals. So when you think about social determinants, we have patients here that struggle in those areas. And we put the time and resources into that program, into those people that allow them to take care of those individuals.
Speaking of, I love this. Speaking of time and resources, we've also mentioned that there's a good bit of number of wealthy people in our community. What does the support for the hospital look like from the community? And as you talk about how people support it, this is your opportunity to say how they can support it some more.
Yeah. So I if anyone has heard me speak before, they've heard me say, this is the 7th hospital that I have worked in my career. This is my 4th CEO opportunity in that time. And I have never been a part of a community that is so engaged with ensuring success of Ascension Sacred Heart Emerald Coast.
Wow.
And that has been great for me. I feel extremely supported by the community. I have what's called an advisory council. So it is a group of 16 community members that meet with me every other month. We give them routine hospital updates, but they are my liaison into the community. And because we're a small community, they're able to reach a lot of the individuals. So if something is not going well in the community, they will let me know. If something is going well, they will let me know. And so they have been incredible. My family, wife included, feel very supported in terms of our connection and sort of helping us acclimate to a new market, having relocated from the Orlando area. And so I cannot say enough good things. And then, not that I haven't asked at all, but from a financial support perspective, the giving in this community is incredible.
That's great.
What I'm saying, having lived here. It's incredible to me still to this day to think about how many successful individuals have decided to make this home and have decided to give financially to this particular hospital. It is just incredible when I see it. A lot of our programs wouldn't be possible. The NICU would not be possible without donations from individuals that live here. And I don't take that lightly. And I want to ensure that we're doing what's right by our community.
I don't take that lightly either, especially because the successful folks who end up in the Emerald Coast are likely not going to be patients in the NICU anytime soon. Maybe grandparents, right?
Yep.
I think that's wonderful. So, we've only got a few minutes left. Any particular needs here as we enter the second half of 2025 and head into the new year? Any particular needs that we can mention to our audience?
No needs, but we have visions of taking this hospital to the next level. We don't always want to be known as the place that delivers the baby, has the NICU. We definitely do, but we want to take that. We want to deliver more babies.
Mm-hmm.
We want to be able to treat smaller babies in the future. We want to offer more services to our community to be able to really keep our community getting cared for in the community that they live.
Mm-hmm.
That's a vision of mine. That's a vision of my ministry leadership team as well. So I feel very supportive in our efforts to do just that. So big things to come for this hospital.
That's great.
In the future, and I'm happy to be a part of it.
So Trey, that's nice bell from the computer saying it was a great message.
Perfect.
Our signature question here on the podcast, and we talked a little bit about this over email, is what does it mean to you to be a Christian capitalist? So as you think about those folks who are giving, who've had this success before they come to the community, what does that mean to you that they are this generous with their resources, whether it's time, talent, or treasure?
Yeah, I think it's an interesting combination of words that you can still be Christian and be a capitalist at the same time. There's room for that, right?
There are people who disagree with me, by the way.
I'm sure there are.
Yeah.
But we have found a way to make that work in the Emerald Coast. I mean, this is a great example of the talent of people here that have had incredible careers, capitalist careers, perhaps, that are also very faith-based in their nature to their core and see a calling to Ascension Sacred Heart Emerald Coast. And again, a number of our programs would not exist today without those individuals. So we're a great example of that particular endeavor.
I love it. Trey, thank you so much for joining us today. It's been a pleasure talking with you. Everybody, thank you for joining us on the Christian Capitalist podcast today. As always, share, like, or follow this episode, as well as the social media posts that we'll see from Sacred Heart and from the Christian Capitalist social media channels. I'm Rich Sanders. Thanks for joining us today. And remember, the more we make, the more we give.